I am Dr. Ila Shukla. This presentation of today would be covering about the evaluation of microbial stability of formulations, how the formulations can be stabilized against microbial attack or microbial contamination. So, this presentation would cover about why sterility test for pharmaceutical products is important, why the products undergo sterility test, why it is required, what are the precautions while performing sterility test, what are the steps involved in sterility testing, what is the sample size that is being done, what are the quantity of the product that is selected for such kind of sterility testing, what are the media requirements, what are the test methods involved, and then membrane filtration or the direct inoculation methods that are being used, and how then we interpret the results. So, the first slide says about what is sterilization. So, sterilization is the process of making something free from bacteria or the other living microorganisms. When we say this sterilization means that there would be no viable microorganism. Viable means any living microorganism will not be there. If we take the sample from there and place it in the culture media, the microbes should not develop. Then we will say that it is like completely sterilized. Then comes sterility testing, a test that critically assesses whether a sterilized pharmaceutical product is free from contaminating microorganisms or not. While we say sterilization is complete removal of microorganism, now how we can find out whether the sterilization was completely done or not. So, for that we done the sterility testing. In that we perform a particular set of tests which critically find out, critically assess whether the sterilization process was completely achieved or not, whether the pharmaceutical preparation or the product which was sterilized was completely free from contaminating microorganisms. Coming to the next slide, why sterility test for pharmaceutical products is done. Sterility test for pharmaceutical products is very mandatory because it is required to find out whether the sterilization process was particularly or properly performed or not, because beyond or without that sterilization test or sterilization methods we cannot consume any kind of preparation, since there are several methods by which the microbial contamination may happen. For that purpose, to clear out that microbial contamination, we need to do the sterilization, and whether the sterilization method was particularly standardized or not, evaluated or not, we go for sterility testing. So, to reveal the presence of viable form of bacteria, fungi, yeast in a pharmaceutical product or device, to find out whether the particular preparation is having viable form of any kind of microbe. Viable means any kind of living bacteria that will either grow or proliferate in the preparation, or it may affect us. Then to monitor the quality of pharmaceutical product before marketing. Moreover, when we talk about a particular market for a medicine, then it has to be like the trust should be developed. So, beyond sterility test we cannot decide upon that whether the preparation is completely fit or completely sterilized or not. For that purpose we do sterility test, just to make sure that there should be no microbial contamination or any kind of microbial contamination that can cause further microbial spoilage. To avoid the contamination, obviously, to assure the safety of the product. Moreover, the product is to be consumed by us, so to assure it, to do a assurance of 2 times whether the product is completely sterilized or not, we go for sterility test just to find out that the product is completely fit for our consumption or not. Moreover, when we talk about the pharmaceutical products, these are being used to treat different kind of ailments. So, if these ailments are not properly treated, maybe these may develop secondary infection or all just because of the microbial contamination. So, just to assure that such kind of microbial contamination is not there, we do the sterility test. Coming to the next slide, it says about what kind of products undergo sterility test. Injections. It is pretty obvious to you also that why injections go for sterility test. These are prepared in highly sterile conditions, even then they go for sterility test, just because when the injections are given, they cross all the defense system of a particular human being. Why? If we ingest a substance, there are several defense systems. Beyond our skin, above our skin, there are several defense systems. All the substances will come for the defense system, but when we inject a substance directly into the blood, we have just surpassed all the host defense system, and so in that case, if there is any kind of microbial contamination, the microbe will directly go into the blood and the that correction of that infection and the detection of infection would get extremely difficult for us to find out from where such kind of infection is developed. So, for that purpose injections, implants. Why implants? Because implants are also placed within the body, either they are subcutaneous or further deeper portions. They just cut a patch from your, either from your arm, from your upper arm, or from your thigh, and they just place the implant and then they again stitch it up. So, it is beyond that particular subcutaneous layer, so that the medicament within that implant is just like a small envelope in which the medicine is being packaged, and these implants are done just to do the sustainable release of the medicine into the body. So, these implants are placed over there, they keep on releasing the medicine for a longer duration, slowly the medicine keep on releasing. For that purpose also, if the implant is not properly sterilized, that can cause secondary infection which could be fatal for that particular person. Then syringes, again the syringes are going inside the bloodstream, so we need to do the sterility test for them. Bandages, since bandages are applied or used for covering or for binding or for this wounds and all. If the cut is there, the skin is not there, the direct subcutaneous layer is being exposed, and we are placing the bandage with that antiseptic this layer with the over that wound. So, the defense system is actually hampered over there. If the microbial contamination is there, it can further worsen that situation. Then dressings, any kind of wound dressings has to be sterilized just to avoid any kind of secondary infection. Then surgical instruments, the surgical instruments being used for the surgery, it could be forceps, it could be the scissors or anything like that, which is actually we are which are using into the body, like directly dealing with the opening that skin layer and the subcutaneous layer, beyond subcutaneous layer. So, these need to be sterilized to avoid any kind of secondary infection. Then needles, again the same thing, going beyond that defense system. Injectables, bulk solids, ophthalmic solutions, the eye drops and all, we need to check them, or we need to do the sterility test at every small point just to avoid any kind of infection, since the eye is a very sensitive organ of our body. Then coming to the next slide, it says about what are the precautions we need to take while performing sterility test. It is not like precautions for us, it is like precaution for the avoidance of any kind of microbial contamination. First is ventilated aseptic rooms, so the regions supplied with bacteriologically cleaned air to avoid accidental contamination by the microbes. What happen in the aseptic area, it is not like that only we just go directly into that area, we just sanitize our hands and start the work. Every person that is moving into the aseptic area is going through 2-3 steps to avoid that kind of contamination, and moreover the air which is being circulated in that particular area is either bacteriologically treated, that no bacterial contamination is there, or moreover it is passing through the HEPA filter, so that the dust particle or the range of dust particle entering that room is minimized. Then highly trained staff, the staff has to be highly trained, because the main contamination, the reason that is the person, the particular factor that is responsible for the contamination, the main reason is the untrained staff or the personnel which is not technically trained. Like if a personnel goes out, touches the handle and then comes in, he should go through all the 3-4 steps that should be done for entering the aseptic area, because once he goes out into the normal environment, the microbial load settles over him. So, he has to go again with the 2-3 steps just to avoid that kind of microbial contamination. Then the working condition in which the tests are performed are monitored regularly by appropriate sampling of the working area and by carrying out the appropriate controls. This point says about, while the, like we take the example of injectables, are being prepared in a particular area, how the sampling or the sterility test is done, the injectables are being prepared. Random sampling is done, a person goes there, take out the sample from the whole of the lot that is moving into the machinery, take out the sample and place it in the culture media, incubate it and find out whether the growth is there or not. If the growth is not there, that means the substance is properly sterilized, there is no microbial contamination. If it is not there, if the bacteria starts developing, that means the whole lot has to be discarded, just because we do not know from where the contamination has started, we do not know the starting point where the contamination has started. So, we will be discarding the whole lot. This we are talking about the injectables. Again, the working area sampling is also done. Why? How working area sampling is done? We take the samples of the air that is present in the environment. We take the samples, we suck the air, we use that air to incubate. We incubate that air, and if the bacteria settles over the culture media and proliferate, that means the air is having bacterial contamination. We will be clearing it out with different methods just to avoid, because all this contamination would be settling over the preparation that is being prepared in that area. So, for that purpose we take the sample of the working area, we take the sample of the preparation being done. Again, the the next step to it is first is the random sampling while the injectables are being prepared. Those are not packaged yet. Then we test for the packaging, whether the packaging is not microbial contamination is there. Like the container which carries this all injectables should not be carrying such kind of microbial contamination that when the vial is opened and then the microbial contamination goes into the injectable. For that purpose also packaging is also tested for the sterilization. So, these are the points which are kept in mind while performing a sterility test. Coming to the next slide, the steps involved in the sterility testing are: first is the selection of sample size. Sample size depends upon the type of material that is being sterilized or the type of substance which is being sterilized. Then the selection of quantity of the product, how much quantity of product is required for the sterilization. Media requirement, what kind of media would be required for the sterilization, like we will be inoculating or we could be incubating the particular kind of samples. So, what kind of media requirements are there. Then test microbes, what kind of test microbes we are going to test, whether those are present or not. For that purpose we will be requiring particular kind of test or particular kind of additive so that we can detect that microbe. Then the method of testing, what are the methods of testing involved, and then comes the observation and the results. So, coming to the next slide, first is the selection of sample size. As per the IP, the quantity per container, the table says about the quantity per container, how much has to be the quantity, and the minimum quantity to be used for each medium unless otherwise justified and authorized. The kind of sample we need to take will be defined by the type of preparation being used for the sterility test. So, quantity per container would be for the parenteral preparations not more than 100 containers. It should be not more than 100 containers. Why? Because already the parenterals are being in a highly aseptic area, so 100 containers would be taking. If 100 containers are not more than 100 containers, then the 10% of the 4 containers whichever is greater. This is the minimum quantity. If it is the lot is more than 100 but not more than 500 containers, the number of container which should be used is 10 container. If the lot is more than 500 containers, then the 2% or the 20 containers should be used and the 10 container for the large volume parenterals whichever is less. So, these are this is the number of vials or the containers which will be used for sterility test, and these are the sample size, how much lot is there. So, ophthalmic and other non-injectables one, not more than 200 containers, then the size would be like minimum quantity would be 5% of the 2 containers whichever is greater. Then if more than 200 containers are there, then 10 containers. Then if the product is presented in the form of single dose container, apply the scheme shown above the preparation for the parenteral use. If it is a single dose container, then this scheme would be applied over it. Then bulk solid products, अगर 4 containers हैं, then each container will be taken, some sample would be drawn out of it. If more than 4 containers हैं but 50 containers से ज़्यादा नहीं है, तो 20%, that means 4 containers would be taken. और अगर 50 containers से ज़्यादा है, this we are talking about the bulk solid products, then in that case if there are more than 50 containers, then the size would be 2% or 10 containers whichever is greater. Coming to the next slide, it says about the selection of quantity of the product. So, it was a sample size. Sample size refers to this is the size which will be given for sterility testing, that we need to get it tested. Any production unit sends this lot for the for sterility test. How sterility test would be done? We will take out random samples out of it, and this is the number how many samples will be taken out. This is the complete lot which is being tested. Then coming to the next slide, it says about the selection of the quantity of the product, how much quantity of product will be used for sterility test. First is the quantity per container, and then the minimum quantity to be used for each medium unless otherwise justified and authorized. This we talked about parenteral preparation, then ophthalmic and other non-injectable preparations, then the bulk solids, the bulk आपका जो भी solid products होते हैं, let it be tablets or capsules. Then the next slide is saying about liquids and other insoluble preparation, and then comes solid. These are the type of formulations of the pharmaceutical preparations which we test for the sterility. So, the liquid is, if the liquid is less than 1 ml, the whole content of the each container would be used. If it is from 1 to 40 ml, the half of the content of each container, but not less than 1 ml. If the quantity of that particular preparation of that liquid substance is less than 1 ml, then complete preparation would be taken as such for sterility test. If it is 1 to 40 ml, then the half content of each container would be taken, that means not less than 1 ml. If it is greater than 40 ml, but it is not more than 100 ml, then it would be 20 ml. If it is greater than 100 ml, then the 10% of the content of the container, but not less than 20 ml. 10% of the container would be taken, but it should not be less than 20 ml. Then comes antibiotics, usually 1 ml is taken. Insoluble preparations है, cream है, ointments है, to be suspended or emulsified, जो भी preparations है either जो emulsified हैं या suspended है किसी particular solution में, medium में, for that purpose use the content of each container to provide not less than 200 mg. We have to select the sample of such preparations in such a way that the particular container or the particular sample size should not be having less than 200 mg of that particular medicament. Then solids, less than 50 mg है अगर solids, तो the whole content of the each container would be taken for the sterility test. If 50 mg or more but 300 mg से कम है, for that purpose the half content of the each container but not less than 50 mg. If it is 300 mg to 500 gram, then 150 mg. If it is more than 5 grams, then the 500 mg is the sample size. Coming to the next slide, it says about the media requirements. What are the media requirements for such kind of sterility testing? First is fluid thioglycolate medium. It is used as it is a clear fluid product, used with the clear fluid products. FTM is primarily intended for culture of anaerobic bacteria, however it is also used to detect the aerobic bacteria. How we define, as I just told you, why we need media? We need media to inoculate the particular kind of bacteria which will be incubating afterwards, so that we can find out the microbial contamination agent. So, first is the fluid thioglycolate medium. It is usually used in case of the clear fluid products. Whatever is the liquid preparation, if it is clear, then the fluid thioglycolate medium would be used with it. And the FTM is usually used for the culture of anaerobic bacteria, but it can also find its use in culture of aerobic bacteria. Then the second is alternative thioglycolate media or thioglycolate broth, we can say. It is used with turbid or viscid products. If the product is turbid, धुंधला सा है, viscid मतलब गाढ़ा है, turbid या viscid product अगर है, उस केस में हम इसको इस मीडिया को यूज़ करते हैं. It is used for the culture of anaerobic bacteria, or it provides anaerobic condition for the culture media. So, the FTM is used for both the purposes, while it is this alternative thioglycolate medium is used specifically for anaerobic conditions. Coming to the next slide. The another media which is being used for sterility test are soybean casein digest medium, or you can say trypton soya broth, or you can say casein soybean digest broth. So, what are the specifications which it is used for? Used for turbid and viscid products, again the same. For both fungi and aerobic bacteria, it is suitable for fungal as well as bacterial contamination, aerobic bacterial contamination. Then the medium 1 and 2 are adjusted to a pH of 7.1 to plus minus 2 you can go. Then medium 3 is adjusted to 7. These are the medium, like the medium 1, this one, the pH is adjusted accordingly. Then medium 3, the pH is adjusted accordingly. Autoclaving is done at 121 degrees Celsius for 20 minutes. This is the procedure how sterility test is performed with this medium. Then coming to the next slide. This again tells you about the media requirement. These are the basic you can say the media that I just told you in the previous slide, that is FTM, that is alternate thioglycolate medium, then SCDM. These are the mediums which I just told you, and these are the composition of the medium, that is L-cysteine, sodium chloride, dextrose, monohydrate, anhydrous, yeast extract is there, pancreatic digest of the casein. These are the compounds, or these are the substances that help in incubating a huge range of bacteria, huge or wide range of bacteria, so that we can find out the microbial contamination. Like if the range of such kind of components is less, if they cannot culture more number of bacteria, then it would be difficult for us to find out the microbial contamination, because a particular bacteria that has contaminated our product will not be growing in such media. If it does not grow, we cannot read the growth. If we cannot read the growth, we cannot find out about the microbial contamination. So, pancreatic digest of the casein, then sodium thioglycolate, then peptic digest of soybean meal, then dipotassium hydrogen phosphate. These are the media requirements for different bacteria. These provide a huge range of chemical substances required for different kind of microbes. Coming to the next slide. So, these are the some examples of particular microbe strains, that test microbe strains which are required by particular kind of media. Like the fluid thioglycolate media, this would allow the culture of Staphylococcus aureus, it is aerobic one. Clostridium sporogenes, it is anaerobic one. Pseudomonas aeruginosa, it is aerobic one. So, since fluid thioglycolate media was showing growth for both aerobic as well as anaerobic. So, the kind of examples it allow for the growth is Staphylococcus aureus, Clostridium sporogenes, it is anaerobic, while Pseudomonas aeruginosa, it is again aerobic. Then alternative thioglycolate medium, it also allow almost both, but more prominently it favors aerobic ones. So, first is this Clostridium sporogenes, again anaerobic, and Bacillus subtilis, it is aerobic bacteria. So, soybean casein digest, it allows this aerobic one. So, Aspergillus brasiliensis, aerobic bacteria, and Candida albicans fungi, that is aerobic. Both the organisms are aerobic, and this media supports only aerobic one. So, coming to the next slide. So, first this slide says about the test methods that are being involved for the sterility test. First is method A, that is membrane filtration method, and another is direct inoculation method. So, we will come to the first one, that is membrane filtration method. Membrane filtration method has a membrane with a nominal pore size not greater than 0.45 micron and a diameter of approximately 50 millimeter. Membrane filter is a sheet which is having a pore size nominal, that means the minimal pore size of 0.45 micron, and the diameter of that pore is not more than 50 millimeter. So, the flow rate, the rate with which the air will pass through this filter is 55 to 75 ml per minute at a pressure of 70 mm per mercury. Then cellulose nitrate filters are used. The substance that is being used for such kind of membrane filtration is cellulose nitrate filters. This method basically involves the filtration of samples through the membrane filters. Membrane filtration method, directly the name suggests, it involves the use of membrane filters. These membrane filters are made of cellulose nitrate that and with a pore size of 0.45 micron with a diameter of not more than 50 mm. The filtration is assisted under vacuum. After the filtration completion, the membrane is cut into two halves, and the one half is placed into the two test tube containing FTM, SCDM medium. What happen in this method? We pass the air, we take this, how we take the sample of the air in a particular aseptic area, because we need to keep a check of microbial contamination in the air as well. So, we pass the air, we take this filter into that particular aseptic area which we will be doing the sterility testing. We pass the air with the pressure, under pressure the air passes through the membrane filter, and when it crosses the membrane filter, the bacteria or the other microbes stay on that membrane, and this membrane will be taken out, cut into halves, and then this whole membrane will be placed into the culture media. The culture media would help the bacteria to develop, and if the bacteria develop and show the proliferation, that means the substance is not fit for use because it is not completely sterile. Coming to the next slide. It is telling further facts about the this membrane filtration method. for the bacteria 20 to 25 degrees Celsius, and for fungi it is 30 to 35 degrees Celsius. It this method involves incubation of 14 days. Oily preparations or ointments can be used with this, can be used for the sterility test for the oily preparations, for any kind of oils or ointments. This method is fit for use, and the product or the volume and the quantity media preparation are given in the table, just before table. Then comes the direct inoculation method. Direct inoculation method says about it involves a direct inoculation of the required volume of a sample in the 2 test tube containing a culture media, that is FTM or SCDM. It is directly we take the sample and inoculate into the medium. It's not like we pass air through the membrane filter and then we take the sample. The volume of the preparation under the examination is not more than 10% of the volume of the medium. Whatever is the sample, it should not be more than 10% of the complete volume of that medium. Then we incubate it, we provide the sufficient conditions and into the inoculated medium for not less than 14 days. It is the same duration as it was given in the membrane filtration method. The same is used for this purpose also, for the 14 days, not less than 14 days. Then product volume and then come to the interpretation of the results after incubating and during the incubation period. If the growth is not observed, then it passes the sterility test, no further thing has to be done. If the growth is not observed, sample is passed. If the growth is observed, containers are reserved and retest is performed in the original test. First test is done, if the growth is found, then again retest is done. After that, if the growth is observed, if they are readily distinguishable from the growing in a container reserved in the first test, if it is so, then the second retest is performed by using the twice of the samples. What is happening? We go for a retest in case the slightest of microbial contamination is observed. Then if they are not readily distinguishable, from those growing in a container reserved in the first test, or if they are readily distinguishable, these are the 2 categories that are formed. Then after that, for this one, if the preparation fails the test, and for this one, if the preparation does not fail the test, the second retest performed using twice the number of samples. If the growth is not observed, or if the growth is observed, if growth is observed, the test fails again. If the growth is not observed, the test is passed. So with this you can see, if it fails the test, that means the preparation will be, whole lot would be discarded, and if it passes the test, that means the preparation is fit for consumption and it will be passed and it will be sent to the market. So with this I just close this lecture. We find out why sterility test is important for the pharmaceutical product. Thank you.